Hello everybody, and thank you very much for coming tonight or this afternoon. Thank you very much, Val, for the invitation. It's always a great pleasure to speak with people who are in the know, and we've seen from Lucia and from Daniel, we're all in the same boat. It's about taking responsibility, it's about educating ourselves, and we really can transform this for us, whether that's in the banking system, whether that's with Propolis, or in our part in the way of holistic medicine, holistic dentistry. So the future of dentistry, in a way, for us, it's about biocompatible materials, it's about metal-free materials, and it's also about to integrate all of that in an individual approach, so that we really look at the individual patient and then create a treatment plan for them. Unfortunately, what we hear tonight is not taught at university. So you're probably going home with much more knowledge in that holistic regard than what your dentist actually knows. And you will also be in the position then to ask the right questions. And then you can see where actually is your dentist in regards to biocompatible materials, treatments that are really beneficial for yourself, or is it about time to look for a different one? And that is really what it comes about. We have to take responsibility. We can't just give it away to other people, so-called experts. We've seen where that leads to over the last 3 years. So, normally I do the start, but we've changed it over the last few months, that Sam starts with the talk. And the reason is that Sam is actually talking about the root cause of the root cause. So, for many, many years, we thought root canals, amalgams, incompatible materials that go into your mouth, they are the actual root cause. Well, actually, we need to dig deeper. We need to really dig into a level that might be new to you, which is our brain, into our emotions, into the blockages of those emotions, where all the issues, where all the real root causes sit. And Sam has developed a fantastic method, bring together many different aspects of healing, whether that's Gerdrike Hamer's German New Medicine, Freddie Nelson's Emotion Code and Body Code, or the light kinesiology, the biophoton treatment. So, give a big welcome, Sam Cooper.
Hello everybody, thank you very, very much for coming along, and thank you for supporting us. Thank you, Elmar. I probably don't have to do much now because he's told everybody else about it, so I'll just give a little talk about what my own dental journey and how the effects of dentistry have affected me over the years, and I have a clue. And you know, I was just so blessed when I came across Dr. Elmar Jung and Dr. Monroe Hall many years ago, when I had my root canals taken out, I had my cavitations done, and you know, one of the things that I felt so blessed about was when I first heard about holistic dentistry, which was about 2006, long before I went to Monroe Hall. And I heard about, you know, my own chiropractor when I was living in Ireland had said about he had gone to a holistic dentist to have his mercury fillings taken out. And it was the best thing that he ever did. He had more energy, he had more brain clarity, and you know, I thought I could do with some of that. So I actually went along and had mine taken out. And I only had a few small ones. But what I found was that when I was on my way back from the dentist so early on, I had complete alleviation of my back pain symptoms, literally just from having the mercury out. So a number of years later, a friend told me about the dangers of root canal fillings. Now, I didn't know too much about this because this was way before, you know, the film Root Cause came out. And what I found that I didn't have a clue that the root canal fillings had all these tiny, tiny little passages running through them and all these little anaerobic bacteria flying up and down. And of course, you know, they're going along our energy pathways. They're causing issues in the tooth itself because the tooth is dead. So when I had my root canals out at the Munro Hall Clinic, I'd had chronic fatigue for a number of years. All of a sudden, my chronic fatigue completely diminished. It got less, and it got less, and it was gone. Gone. Amazing. Now, moving on, I started to think about, you know, I never looked at my health quite the same again. And I thought to myself, you know, why is it that mercury amalgam filling, or mercury, goes into a practice, and it's in a box, it's got skull and crossbones on it, and yet they deem it safe to put it in our mouth? Now that struck me as very, very strange. I mean, it has to be disposed of as a biohazard. It's biohazardous waste, so it has to be disposed of in that way. And what it seems to me is that, you know, when I've done the research, this mercury vapor is actually, it's leaking 24/7. It's not, you know, we bite down on it, we're chewing on it, and it's leaking. And I thought, well, why is it that so many dentists actually retire with ill health? And we find that, you know, a lot of them drink a lot or they have to retire early. Now, could it be as a result of the mercury vapor that's being released? And, you know, most dentists are not using the SMART protocol, which is the safe amalgam removal. So, and then I thought about it a little bit more, and I thought, so why is it one tooth would be affected and not another? Why is it a back tooth? Is it to do with not cleaning your teeth properly, which I have to say is a bit of a myth, or is it something else? And I found that it was something else, which I'll discuss with you. Now, when Dr. Jung and I established our practice in Southampton, we were thinking about what are the best things that we could support the practice with. And we thought, you know, we need a dental practice that supports natural solutions for the body, because we want to look at the whole body-mind system. And so in our practice, we offer nanographene oxide-free dental anesthetics. That's the first thing. We use biocompatible dental fillings. We only use 3 companies, and these filling materials do not have any tegmas, any BPAs, or any other nasty chemicals. And, you know, it's important for us, our dentist was always testing kinesiologically for the individual patient which is the best filling material for them. And that is important because everybody is unique. And we were the first practice in the UK to actually offer the Cavitao scan, which is an ultrasound scanning device which actually looks at the bone density and can tell you whether you've got bone infection, jaw infection, or any cavitations. We also use the SMART protocol, very, very important for removing amalgam. So it protects the patient, it protects the nurse, and it obviously protects the dentist. And we also offer a supplementation protocol that when anybody is having any sort of surgical intervention, we provide that supplementation protocol before and after to support their whole healing journey. And in addition, we use a form of therapy that embraces quantum physics and reduces the stress in the body and mind. And that is what I'm going to talk to you today about. Now, how many people knew that in your mouth, each tooth connects to a meridian? connects to a meridian pathway. Great, a lot of you, excellent. And did you know that each tooth is also associated with an emotion? And there can also be an organ link. So hands up, has anybody heard of, you may not have heard of psychophotonics, but has anybody heard of light kinesiology or biophoton therapy before? Great. So I'm going to start with a story, and it's a story about a lady who absolutely is terrified of going to the dentist. Like so many others, she had a horrendous childhood experience and has never forgotten it. Now, whilst her dentist was a frightfully pleasant chap, it took her 5 attempts to actually have a tooth extracted, because each time she sat in the chair, she just couldn't face it. And she got up and simply ran away. But this lady had heard about natural health, and she'd heard about biological dentistry. And when she came along to see us, she saw Dr. Jung and felt immediately at ease, until he told her that she had to have another tooth extracted, which didn't go down too well. But before she had anything done, she would have to come and see me and have a biophoton treatment. Now, what do we know about biophoton therapy? Well, the idea is to reduce the stress in the entire mind, body, spirit system to bring about regulation in the body. And what happens, the patient lies on a special acrylic plate which amplifies your whole morphogenetic field. And we perform a series of tests using kinesiology or form of kinesiology to discover the blockage or the stressor in the field. And then we use the most appropriate biophoton mirror to actually release that blockage. Now, what happens is these frequencies filter down through the morphogenetic field. They filter in through the meridians into the subtle nadi system, and they eventually go into the cell, and they bring into the cell coherent light. Now, we also use a pole filter, which allows the incoherence or interference pattern to be pulled out of the field. So effectively what we're doing, when we're using kinesiology, we're communicating directly with our innate wisdom. And we're using it in its own language. And what I do is I follow the priority of the unconscious mind to give me that information. Because let's face it, an individual's unconscious mind is the expert of them because they know everything about them. I'm just the therapist, so I take my lead from the individual's unconscious. So this is where it gets interesting, because I've created this system called psychophotonics, which takes 3 healing modalities. And what we are able to do is we can clear the pathways directly into the brain and find where the trapped emotion or trapped blockage sits in the brain. And then we can release it directly. Now, as a healer of 25 years, I know that we have the capacity to truly heal when we look at the whole system, mind, body, and spirit. My journey into the healing arts in psychotherapy, NLP, shamanism, has shown me the powerful combination of working with the unconscious mind and the higher self. Because whilst your higher self, at the level of personality, expresses your soul's light, the unconscious mind is the intermediary between your higher self and your physical form. So I'm going to talk to you a little bit about the unconscious mind. So the unconscious mind has the capacity to process 12 to 14 million bits of information per second, whilst the conscious mind can only process 7 plus minus 2 bits of information per second. It's a highly moral being, based on the integrity it was taught and accepted. Now, the unconscious mind takes literally everything personally. It has a mental age of 6. And it uses the language of metaphors, stories, and emotion. And then it senses through the six senses. But not only that, it has access to your perfect health blueprint, which is held in the higher self. So it knows absolutely everything about you, so there's absolutely nothing you can hide from the unconscious mind. And every so often, it will bring up a memory that you would rather forget. Now, the unconscious mind knows that if it keeps that painful memory stored for any length of time, the density of that energy may at some point be detrimental to the body, and it will eventually cause disease if it's not eliminated. Now, by this time, if many of you are fast asleep, don't worry, because your unconscious mind's got all of it. So, as part of my research into this methodology that I've created, I came across the work of Dr. Geert Hamer, who did Germanic New Medicine. Hands up, who's heard of German New Medicine? Yeah, a few of you. Good, 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 good. So it was after Dr. Hamer's son, Dirk, was fatally injured, that 3 months afterwards, Dr. Hamer actually created testicular cancer. Now, it occurred to him that this tragic loss could be, could actually be causing his disease because of the grief that he was feeling. And so he decided to come to terms with his grief, and once he'd made a full recovery, Dr. Hamer explored with all his cancer patients if any of them had suffered any psychological trauma. And he found in every single case that they had. So he conducted a series of brain scans with patients and would observe these tiny, tiny little circular patterns in the brain when disease was present. These patterns would form with a particular disease and would link with a particular organ and energy pathway. So he would recognize the link between a particular type of trauma and where the disease would actually start. Now, when the trauma was discovered and realized, the patient would stabilize and heal when he finally let go of that trauma. So we combine German New Medicine, which helps us to discover not only the type of conflict, but we can discover the type of emotion and trauma and location of it in the brain and release it. We discovered that this would have a far greater effect than me consciously identifying a particular tooth and then going through that tooth to clear the emotion. This was far more powerful because we were going directly into the brain. This is where everything registers first. All trauma registers in the brain, in the nervous system first. Then it was Dr. Bradley Nelson. Now, who's heard of Dr. Bradley Nelson, who wrote the emotion codes? Has anybody read it? Okay, I'll let you off. So he identified certain trapped emotions hidden within the body. He wrote a book called The Body Code. I believe he's going to be bringing out another one soon too. And he used kinesiology, different types of muscle testing, to find out, give yes or no answers and determine the nature of the emotion and then release it. And like Dr. Nelson does with the magnets, we now do with the mirrors. So we're using it in exactly the same way. Now you may be thinking, what on earth has all this got to do with dentistry? Well, Dr. Jung now insists that all surgical patients undergo the biophoton treatment because what we have seen, the benefits of, have astounded us. Reduction of pain, swelling, adverse reactions after all dental surgery. There appears to be significant reduction in jawbone infection reoccurrence too. Not only that, patients experience a sense of clarity, a sense of inner peace and well-being, and they even find purpose once they have released this trauma. And this is simply because we are able to go into the deeper root cause, excuse the pun, and clear deep-seated emotions so the body has less stress. Now, what's fascinating is we undertook a biophoton study whereby each participant, first of all, had a cavitao scan to measure the bone density. Now, each person had an infected tooth or a series of infected teeth in the mouth. Each patient then had one biophoton session per month with myself. They were also given homework, and we did this for 6 months. We also tested them for a supplementation protocol to support the healing process. And at the end of the study, a further cavitao scan was done to measure if there was any change in the bone density. Now, what we discovered was phenomenal, because in every single case, every patient with every tooth had healed without surgical intervention. In addition to their tooth infection resolving, many patients also experienced a dynamic growth process and noticed that certain conflicts in their life were now resolved. So, excuse me while I have a slurp. What happened to the lady who had the biophoton treatment? And the day of her extraction dawned. She sat straight down in the dental chair and she had a tooth extracted. She didn't move, she didn't run away. Not only that, the moment that tooth was extracted, she burst into song and sang a childhood hymn. The moral of the story is never underestimate the power of the mind to create suffering, but equally to overcome it. So what do we conclude from this? We know that true healing takes place in mind, body, and spirit. We're an integrated organism that cannot be compartmentalized. We can measure our progress by asking ourselves, how does my outer reality reflect my inner experience? Am I getting what I want in my life, or am I only getting by? There's no denying that emotional energy influences the whole organism. So, when we utilize fantastic tools such as the emotion code, German new medicine, and biophoton therapy, we bring it all together. It helps us to identify and release previously unconscious energetic patterns which could be contributing to our overall health. We release these limiting beliefs, we release these behaviors, and we start feeling empowered. So I say to everybody, look at the emotion code, learn about kinesiology, because it's a wonderful feedback system. It helps you to experience, firsthand the power of the unconscious mind in action, and a little bit of perseverance. You can learn how to muscle test yourself, using dowsing with a pendulum, or just simple muscle testing, swaying tests. There's numerous ones that you can use. Biophoton therapy and psychophotonics actually gives us the opportunity to learn how we can become the best version of ourselves, and ultimately supports the unfolding of pure human potential. Now, isn't that exciting? Now, I'm going to leave you with one final little gem. Have you ever seen how your pets shake stress out of their body? Yeah? So, like the antelope, when it's being chased across the Serengeti by the lion, if it eventually, if it is fortunate enough to escape, the first thing it will do will be to shake, because it is shaking the excess stress out of its body. And it'll do that because that emotional energy will otherwise densify and cause later disease. Now, we as humans don't do this. We don't shake, we don't release that excess energy, and so it gets suppressed. And so the next time you get angry or upset, have a good shake. Have a good shake. Your teeth will thank you. Thank you very much. Goodbye.
Well, we do that later. I first have a shake. Okay, we saw that before. We know there are thousands and thousands of diseases all over the place. They have labels. Doctors need to call them because otherwise they can't write a prescription. So the question is, what percentage of disease are actually coming from our mouth? What do you think? 80. Good one. Anyone else? Other numbers? 20, 10, 15? No? Okay. Are you up for a little experiment? A survey? It's not grabbing shoulders, massaging, or anything like that. If you could quickly stand up, most of you will sit in probably 30 seconds. Right. So what I do now, I say some words that all connected with dentistry. If you had them, if you have them, just sit down. Amalgam fillings. Root canals. Root canals. Tooth extraction. Oops. You're still standing? Okay. Gum disease? You've ever been to a dentist? Yeah. Okay. Even that affects us. And the reason is, as Sam already said, it's about the mercury that is not just in your mouth, that is not just in all the pipes, it's also in the room. Because with all the drilling, and not drilling it properly like the SMART protocol, it evaporates and then it sits in the surgery. So you're walking through mercury when you go to a dentist who doesn't use a proper protocol. So, how much time do we have?
Well, I mean...
Okay, a quick story. There was, at the very beginning of my career into holistic dentistry, we just moved down to the Lake Constance, and it was a lovely summer day like this, a Wednesday where we normally are free in the afternoon, and I hear the telephone ringing. Receptionist goes there, comes to me and says, "We have an emergency. There's a mum with her 13-year-old daughter, and they need to see you. They only have 3 days." Didn't say anything about that. So anyway, I finished the other patient, and whilst the nurse was cleaning up the surgery, I go in the waiting room, expecting a mum with her 13-year-old daughter. But what I saw, it really, really shocked me, because that 13-year-old Christine, she looked like the Michelin Man, bloated, full of liquid, in pain. She had a plaster on her left leg, and she has been to all different specialists. They have done tests over tests over tests, and they didn't find a thing. So it started about 6 months ago, they said, with pain creeping up from her toes into her calves, into her thighs, all over the body, headaches, migraines. She got brain fog, and she couldn't really, forgot to put that on, she couldn't really concentrate anymore, so she had to stay at home. And she got weaker and weaker, just put on weight, but that was just liquid, lymph not working properly. Then she had such a massive pain in her left leg that the GP had put a plaster on her. There was nothing broken, nothing wrong. So headmaster and GP got together and said, "There's something wrong with the girl. She's just making that up. We need to really tell her what to do." So they told Mum, "We will institutionalize your daughter. She will be sectioned, and then she has time to think about all the nonsense she's doing, and maybe she comes to senses." So, and then I thought, no pressure on you, Elmar. Why did you come to us? And she said, "Well, we have some friends who came to you prior to us calling, and they had really good results. So we thought, we've done everything, we tried everything, we'll give that a go. And I thought, okay, well, yeah, have a look. So I guided them in the waiting room, from the waiting room in the surgery, and I asked her to open the mouth. And there was no filling. All looked perfectly fine. Just a tiny black thing at the very end. A filling, a silver filling. And I thought, that might be something. So I asked them, well, when were you last with a dentist? And they said, about half a year, 6 months. And so I thought, wow, if that is the case, I'll talk with the GP and with the headmaster and ask if we can keep her in our care for 3 months and see what we can do with her. And so we had to have the plaster off, take the amalgam filling out, and gave her lots of infusions to help the body detox. Within weeks, she got better and better and better. After 3 months, she was back to school, and even better than before. So that tiny little amalgam filling caused all these problems. Well, that's not really true. Because when I saw what she is presenting, I asked, Mum, please open your mouth. And the mouth was full of amalgam fillings. So what happened? During pregnancy is the best time for women to detox, because they give a lot of stuff into the unborn. And even when it goes on with breastfeeding, you still keep going and detox into your little one. Now, I'm not saying do not breastfeed. I say you must breastfeed. It's very, very important. But what happened with Christine is that she was already predisposed with that mercury. And so this tiny little amalgam filling just shoved her over the cliff. Now, luckily, we don't see many of those situations, but we also need to wonder what's going on in mental institutions. And so there was another important issue, because Dad also had a lot of amalgam fillings. And what that means, Professor Boyd Haley discovered 20 years ago, is that when Mum and Dad have amalgam fillings, the likelihood of the little one to detox is diminished. So you sit with all that pile of mercury and you can't get rid of it. And if you then on top of that have a gene that doesn't work in your favor for the detoxing process, then you're really, really stuck. So if we then look into health, why is it so important, our health? And if we know it's so important and it's our priority, why do we give it away to these so-called experts, so these fearmongers and doctors, politicians? We need to take responsibility. We need to really keep ourselves educated. We need to look into these things. We can't just say, oh yeah, well, at some point someone will work it out, or it's not that bad. We really need to look into that. And that is what I want to present to you today. The 5 key learnings for dentistry, the 5 stumbling blocks in a way. What do we need to look when we go to the dentist? Now, it's not all doom and gloom. I mean, I will tell you lots of things that you don't want in your mouth. However, there are also options or you can have. And we also need to say that what is bad for one person might not be bad for the other. So we see patients in their 80s, mouth full of amalgam. Will I start taking amalgam fillings out? Of course not. Why would I start entering into a system that has made it 80 years with no symptoms? So we really need to individualize these things. And as long as patients are aware of what they're having, That's another point. You need to really know your options. You need to know the benefits, you need to know the disadvantages, and it's all about knowledge. As long as you know what you're buying into, it's fine. Because it's your decision and you must make the decision. So what are the 5 key learnings? It's poisons, toxins, infection, inflammation, it's the structure of the body, and it's also then the tooth-organ connection, what Sam already talked about, and the psychophotonics. So we can probably skip the tooth-body connection and the emotions and go to poisons, toxins. Now that is in Germany, because you spell it pissed. And it's a good anchor for you now. Now you know what it is, because it's easy to remember, a pest. So it's poisons, infections, structure, and the tooth-organ connection, as well as the emotions. Right, what are poisons? Amalgam can be poisons, composites, fluoride, root canals, dead teeth, implants. Sam already mentioned the composite fillings. So it's very, very important when you say, yes, I have decided to get rid of my amalgam fillings, I want the white ones. Well, it's not that easy, because there are hundreds of white ones that you actually don't want in your body. And the reason why, what makes a substance toxic, it must contain the toxin must release, and it must accumulate in your body. Ticks all the boxes for amalgam, ticks all the boxes for certain composite fillings. I think we don't need to go far into amalgam, we can really skip that quickly, but you can see that amalgam is actually affecting everything. Whether that's your thyroid, your gut, your brain, your gums, your antibiotic resistance, so we have it all. Composite fillings, most of them contain fluorides, most of them contain BPAs, and affect the brain, the bone, the thyroid. Thyroid is a very, very important gland, as we all know. Whether it's amalgam, whether it's mercury, whether it's chlorine, bromine, they all are competitors on the thyroid cells for iodine. So we need to have a high load of iodine to really counteract all these things. If you shower or bath in tap water, your body is soaked with chlorine. And the same goes with a lot of clothes, with a lot of furniture. There's bromine in, it's a fire retardant. And same is with the amalgam, and also, that's quite an interesting one. Reduces IQ and makes docile. They use it in concentration camps to make sure people stay really docile. And it's the one thing that is really important to get is that tooth decay is not due to a lack of fluoride. And it's also not caused by bacteria. Bacteria are just opportunistic critters, they take what they get. And if your body creates an environment that they can thrive, well, happy days, they will. So it's about us to really make sure that we create an environment that is health beneficial, that supports the bacteria that are really helping us. And without bacteria, we wouldn't even be here. So we just need to find a really good balance. Now, root canal is a big one, because we know that root canals, not only do they prevent energy from flowing properly, we heard about the tooth-organ connection. We heard about the tiny little channels in each tooth. and that's 3 to 4 miles per single tooth. So it's never ever possible to make that sterile. And even if you could make it sterile for a moment, let's say we use ozone, which goes through all the channels and makes the tooth, let's say disinfects it rather than sterile. As soon as you stop with the ozone, the bacteria will migrate in back and you're in the same situation as you've been before. So the only solution from a holistic point of view, if a root canal treated tooth makes a problem, is, in my point of view, to have the tooth out. Now, what I'm telling you here is my experience over the last 40 years. If you ask 1,000 or probably 10,000 other dentists, they say, Elmar is bollocks or nonsense. However, we have the experience. We've seen it from day one, how people get better when they have got rid of root canals, when they have got rid of the cavitations. And that's, for example, you can see the white spots here, the lines. These are the root canals, and the black part where the arrow points to, that is where the bacteria have created bone defect. So black means it's a rather hollow bone. That's a really good book. Root Canal Cover-Up is from a dentist who was president of an endodontist society in the States. He came about a book or the research of Weston E. Price and brought this up to light, what actually can happen when you have root canals in your mouth, that they are far likely to cause trouble away from the location where they actually placed. They are very rarely cause trouble in the area that you get pain from it, but you get pain in your joints, in your muscles, because that is where the bacteria sit, where they go. And they always go to the weakest spot. And that's a brilliant book. I know the author. That is a billion-dollar market. Metal implants. You don't want one of those in your mouth. We take them out a lot. And it looks really, really bad around them when we take them out. The reason is titanium, out of which those metal implants are made, reacts with the jawbone. And so there's a constant flow of ions going on between the metal and the bone. And we see a lot of areas in the bone around the metal implants where there's actually no contact to the implant, where there's just inflammation, necrotic bone, fatty, degenerative bone, and it's as bad, if not worse, than root canals. Also, nowadays, with Wi-Fi, EMF, and that all, you want to be metal-free. You don't want to be an antenna. So that is what metal implants really affect. And as with root canal treated teeth, it's a foreign body, and therefore it will cause a reaction from your body. Now there are other options. There are options out of ceramic or zirconia. Now our body doesn't crave implants. It doesn't say, give me more, give me more. It will react to it, and that's the reason why we have never done implants, because our patients, most of them, are chronically ill. So why would I want to give someone who is chronically ill and already at the edge of the cliff something else that the body needs to compensate for? For me, it didn't make sense. Only when you have got rid of a chronic underlying issue and your body is healthy, is capable to actually deal with more of those infections that might come up, or with more information that needs to be dealt with, only then the body should actually get something else in it. Root Cause is a brilliant movie from a documentary maker who went through it. He had an accident, he had a root canal, and he had an implant. And he experienced all these things that we were just discussing on himself, and has quite a few interviews with good people. Professor Dr. Rao from Switzerland. I mentioned that before. Infection, tooth decay and jawbone and gum disease, they are not caused by bacteria. They are caused, from my point of view, by a systemic disease. Because the question is, why is it the lower left premolar that gets a decay and not the upper right incisor? There must be a reason why at that point where that tooth stands is an issue in your body. And if we then trace that back with a method that Sam provides, then we get to the root cause. Then we find out why the tooth decays. And so we can then provide our body with proper nutrition, with proper supplementation, so that it gets into balance again. And it's really important that we get away from this bacteria-driven, in a way, thinking. We need to, as Daniel said, we really need to create a new system and make the old obsolete, as Buckminster Fuller said. I totally agree with that. Jawbone osteoporosis develops mainly when a tooth has been extracted and it hasn't been cleaned out properly. So what we do when we take a tooth out, not only does the patient go on a specific protocol with supplementation, they get vitamin C high dose, vitamin C infusions during the treatment, we scrape the bone, we use ozone a couple of times, we take blood from the patient, and then we separate it in a centrifuge so they get the white blood cells, it's a big yellowish blob. We put that into the hole where the tooth was or where the infection was, and then stitch it, and that heals wonderfully. But if you only rip the tooth out, and that is done mainly with wisdom teeth, then it's almost a given that those teeth or those areas develop cavitations. And we also need to look into why are wisdom teeth taken out. It's not always, and in most times, necessary. They're sitting there, even if they're impacted and we test them and they're energetically fine, we'll just leave them. That's how jawbone osteonecrosis looks like. So it's this here, and it's very interesting because there are, in a way, three situations that we can find when we go in there. So we cut through the gum, and most of the times we can go with a sharp instrument straight into the bone, and then there are three things happening. Either there's a lot of oily brownish liquid coming out, it's hollow and nothing is in, or it's a yellowish necrotic infection that we see. Now, no matter what we see, we need to clean it out. We need to scrape the bone until we come to hard bone where it bleeds, because only when the bone bleeds do we know that it's actually a healthy bone. And Richard is a very short story. He had been to doctors for 5 years, suffering from diarrhea, constipation, and he showed me the bills, tens of thousands of pounds for tests, for surgeries, and no one found out what's going to happen and why it's going to happen, that he has this intermittent constipation, diarrhea. And we took a big x-ray, we found a tooth that's connected to the large intestine. There was an infection, a massive infection, took the tooth out, and 2 days later, he haven't had any diarrhea, any constipation anymore, and he never had it again. Structure is a very, very big part, and not many look at that. And we don't go through all the different points that actually influence it. I would love to talk about, in terms of structure, what we can do for our kids. And mouth breathing is one of the things that we need to see that we can get them rid of. And therefore, it is so important that children, when they come out of the womb, that they are really looked after, that they get the breast, that they get the breast for at least 6 to 12 months, that we know how to breastfeed them properly. Because what happens when they breastfeed is they need to bring the tongue in the right position. So they need to really squeeze the milk out of the nipple. So they work really, really hard. That's why they are tired once they've finished. They've really worked hard to get that milk out of the nipple. And by pressing the nipple to the palate, gives information to the palate to expand. They also learn how to swallow properly by doing that, because the tongue is in the right position. And they learn to breathe properly because the tongue is in the right position. And it's also very important that we look, just when they pop out, have they got a tongue tie? Because if they have a tongue tie, they can't push the tongue to the palate. And they're really, really prohibited in a way to learn proper swallowing, proper drinking and breathing. And all those issues will then come later on. There's also allergies, there's food intolerances, all that come with not breathing properly or not being able to swallow properly. And that is a biggie. So if you go to the dentist with your kids, grandkids, and they say, looks all fine, it's a bit crowded, let's wait until they're 12, 13 years old. And then you come back when they're 12, 13 years old and say, oh, I've got really, really little space now. We better take 4 teeth out to create some space and bring them together, put them in a prison with metal braces, move them about so where we think the teeth need to be, and then you end up with all these things. You have a relapse up to 90%. The teeth just move back to where they were because it's not their natural location where we put them. And taking 4 healthy teeth out, I think, is criminal. We mustn't do that. It's a total damage. And having kids when they are 12, 13 years old with these braces fitted is putting them into a prison at a time when they actually want to expand their personality, and we crush them in. And in 100% of the times we see teeth, because they are moved so forcibly that the root of the teeth, they have a damage, they look shorter because the roots were absorbed. And we know that it doesn't work because they have to wear a retainer for the rest of their life to keep the teeth in place. And here are the advantages of functional orthodontics. We don't extract teeth. We start early when they're 4 or 5 years old, checking what kind of habits do they have. Do they still suck their thumb? And do they breathe properly? Have they got a tongue tie? Get rid of all these things and developing the jawbone naturally so that the teeth have the space and are getting to go in the right position so the kids have a lovely smile, a broad smile. That's what we see with all these indigenous people. they don't even have names for gum disease or tooth decay, and they have these broad arches. That's what health is all about when we do that correctly. They have proper facial development and obviously an improved health. We skip that. So the importance really is that we look at all these pissed things and that we give information to our friends, that we inform them of the opportunities that lie in dentistry, that we can do so many good things, and that we need to realize that dentistry is part of medicine and is hugely important to get that right. And dentistry is the most overlooked and underestimated suspect when it comes to especially diagnosing chronic diseases, because no one knows about it. Doctors aren't educated in it, and there will be more and more patients who know about it. There are also more and more practitioners who know about it, but at the moment, at university level, we're not taught about these things. Right. That was quite quick. Any questions?
This across to regular dentists? I mean, like, for example, the fluoride thing that they're always trying to badger people.
I think it's really about what Buckminster Fuller says. You need to create a new system. Because, yes, I did that at the very beginning, and you just get a bloody nose. It's not worth the time, the effort to convert people who are comfortable in their system.
I was surprised to hear that the mother, what you said, the mother detoxes into the baby during pregnancy.
Correct.
Can you say much more about that? I never heard about that before.
Well, it's in a way common sense, because it's the same blood that runs through her and the baby, and so she gets all that. And when a baby comes into this world, nowadays it has already more than 200 toxins in the blood.
Yeah, sorry. I've heard about dogs, and when you've got a dog, the dog takes a disease from you. It can save your life, and I don't know. Is that what's happening with the mother? Might be getting rid of emotional stuff into the.
Well, it's on many different levels. It's on the physical level, where they just pass on the mercury or whatever else in toxins and stuff they don't want, or have now another filter where it can go through. It's not that they deliberately push it over. It's the normal blood flow. And obviously, yes, absolutely, they will take on all the emotional things.
Yeah. I actually experienced emotional detox from my mother. If you want to share, she lost twins before me, and I only found this out about 40 years after my birth. She lost twins, and then she was afraid to lose. What I found out through family constellations is that she was afraid to lose me, and when I was born, I cried for weeks, and she never expressed her grief. And then about 40 years after my birth, I could finally find out that I cried for weeks, and I was expressing her grief.
Yeah.
So it was like.
Absolutely. And that's exactly what we find. That's also what we see a lot when little ones don't have any amalgam fillings in their mouth. They are still massively intoxicated by mercury. And with all the vaccination going on, they get more mercury in their bodies. So it's coming from all angles, and therefore we all know, as we hear, vaccinations don't work. and what we had with the mercury issue is really that we have to get this to parents. They need to get rid of their mercury fillings before they even conceive, so that this gives a good start for the little ones.
Staying on that theme, the thing I wanted to ask is I've been very aware over the last couple of years with the changes in the vibrations and the energies that are going on, that my body physically, spiritually, emotionally is going through a huge transformation and a huge process, and I think there's a level of detoxing that happens. And I hadn't thought of this before, but could it be that I've got a fair number of mercury fillings that at this point, with the combination and the change in vibration and frequency, I'm actually detoxing from my fillings, and that's part of the process I'm actually experiencing.
Yeah,
So that's
absolutely.
kind of what you're saying as well.
Yeah, because that's the other thing. When you have amalgam fillings in your mouth, you detox, or better word, no, it's the wrong word. Mercury vapor comes out of the fillings 24/7, and that goes into your lungs, that goes straight into your blood, because it not only goes into your mouth, it goes into your teeth, into all these tiny little channels, and every single tooth is an organ, so they are blood vessels, goes straight into the blood vessels. And therefore, when we remove amalgam fillings out of the mouth, we also then need to remove other metals in the mouth because they've been contaminated with the mercury, and we need to detoxify our body from the mercury that got into the body over all those years that we had them. Yeah?
Is there anything that you can do in the absence of not being able to have the mercury amalgam fillings removed to help the situation?
So the question is, what can I do if I haven't got the time, the funds to have the mercury fillings removed? The easiest way to do is rinse with charcoal. Because charcoal grabs the mercury, and then obviously you don't swallow it. Yeah.
Is that ground up charcoal?
Doesn't matter what it is. Yeah, they are charcoal. Well, you don't need to buy charcoal toothpaste because that's insanely expensive. You just put, yeah, that's the other thing. You just put charcoal. Yeah, well, you can do it pure. Yeah. Yes.
Such a bit of advice. My daughter's got her first orthodontist appointment on Friday.
Right.
She's been waiting a year for this appointment. Apparently her back teeth don't bite down meat at all. She's 14. I'm not having braces. How do I handle that?
Well,
We don't know what's going to happen yet. We've not even been, but we're waiting a whole year for this specialist appointment.
well, we'll be like, she might need teeth out if there's a crowding.
No, she's had teeth taken out already.
Ah, right. Okay. So then it's about what other therapies can be helpful. How is her bite? How can we help? Because she's still developing.
Yeah.
So functional orthodontics will still do something. It just comes later. But you can still do something about the bite.
Yeah.
You can still do something about those extracted teeth. And what is always a good idea...
She's petrified. She's absolutely petrified.
Of course, I would be. A very good idea is also to see an osteopath, cranial osteopath, because they can work with a skull. And that's the other big thing. If you have braces in your mouth, everything is fixed. Those bones don't move. So it's not just that we're creating a prison and keep the teeth in check. It's the entire skull. And it's not just the skull, it's the entire spine, because that doesn't move properly either. Yes.
What's your take on the connection between root canals and women and breast cancer?
Good one. Yeah. Actually, that comes from Professor Thomas Rau. I've been in this paracelsus clinic when he looked through those records, and what we found was, I think it was about 160 breast cancer patients, and 158 of them had breast cancer, had a root canal, sorry. And most of them had the root canal on the site of the primary tumor. So it's quite a high coincidence.
Is that the same with implants as well?
I'm not aware of any study, but I would imagine it could be similar. Yes.
Brilliant talk, by the way.
Thank you.
What do you recommend to your patients for missing teeth if they can't have an implant? Do you recommend a denture?
Yes.
Yeah, okay. Plastic denture, so you don't chrome.
Yeah, no metal. Totally metal free.
That's my follow-up question. I want to know about dentures. Can they be made from biocompatible materials?
Yes. They can. And whether they are biocompatible depends on what your body reacts well to. So, as Sam said, we have 3 brands, a French, a German, and a Swiss, and they're all biocompatible, but they still don't test with every single patient. So that's why it's so important that we test everything that goes in the patient's mouth, and not just, oh yeah, white fillings, great. Yes?
Excuse me, thank you very much. Are there many holistic dentists in this country, or are they very hard to find?
Well, if you look for a holistic dentist in the way we do it, it's definitely difficult.
I know of one. And he's totally on the same page as you. His name is Dr. Dirk, and I can't remember his last name. I think he's Dutch.
Where is he? He's German.
Is he German?
Yes.
Do you know him?
Yes.
Dr. Dirk, what's his surname?
Yeah.
He's in Wellington.
He's where?
Yeah. So there is options.
Yeah. Well, there are only options if you really compare what dentists do. Because holistic is not a really trademarked thing. And there are a lot of dentists who say, oh yeah, we're holistic. So what do? Well, we don't use amalgam. But that doesn't say anything how they remove the amalgam, and they still do root canals, they still do metal implants, so you really, really need to ask the questions. And we dentists don't like that. So well, that's one thing. Rubber dam, you need to be fully covered, you need to have special breathing devices on your nose. So there's a special technique to removing the amalgam fillings. Again, you need high-dose vitamin C infusions, glutathione. The doctor, the dentist, the nurse, they also need to have special protection. So it's really a big, big protocol.
It is poison, isn't it?
No. Who told you that? Conspiracy theorist.
I've just got a question from a friend. As ceramic inlays are less durable than amalgams and significantly more expensive.
Who says that?
Lauren.
Yeah, but that's not true. They are not less durable.
Oh, aren't they?
No.
All right, okay. Roughly how long do the ceramic fillings or inlays last?
Well, it depends on who does it and what the care is for them. But then if we see amalgam fillings, they expand over time. So they kill your tooth, they crack the tooth. And composite fillings don't do that. They really bond with the tooth and make the tooth stronger. Yes?
I just think it's interesting that when your mom is pregnant, you are given free dentistry. So you often will have, as I did with mine 35 years ago, a whole host of work you couldn't afford to have done before. Most of it amalgam fillings, which you then later learn not only have you poisoned yourself, you've poisoned your baby.
Yes.
You know, you can now spend a fortune to get removed. Yeah.
Yes.
Everybody would think there was a cabal.
Yes. I brush 5 times a day. Any other questions?
Are you taking on any new patients then?
Of course we do. Yeah, because we don't want to keep our patients. What we want is to do everything we can do, replace the amalgam fillings with biocompatible materials, get rid of the metals, get rid of infection, make the structure right, all the 5 points that we put here, and then we want them to be happy, go back to their home dentist. Now, once they experience what we do, they never want to go back. But still, yes, we take on new patients.
And you're based in Southampton?
That's correct. I don't work anymore as a dentist, but we have a fantastically trained lady dentist.
And she's wonderful.
Thank you.
Can I?
Yes?
This is one of my, apart from my fear of dentists, but one of my fears is having teeth taken out by ladies. In case, I'm really sorry about this, but in case they're really not strong enough. Yeah, does that happen?
No. Well, it might happen, but it doesn't.
Really difficult teeth to get out.
Well, what we do.
You want someone really big to do it.
No, do you actually want someone who is really good with those teeth, rather than strong and just breaks it out? And we have specific techniques. So if it's a tooth that has many roots, we separate the tooth so that we take the roots out individually. Yeah.
Thank you.
You're welcome. And it might be an idea to see Sam.
I'm going to see Sam.
Yes?
I just want to say that I learned something when I was pregnant back in the 70s that actually I wish my mother had learnt when she was pregnant with me, and that is to have vitamin D throughout the pregnancy so that the skeletal structure is wide, because otherwise it's overcrowding, and that combats overcrowding, vitamin D.
Well, that's quite a point you're making here, and I wouldn't say it in that connection. I think it's definitely important, but you can't say vitamin D takes away overcrowding.
No, probably
It's the yes, absolutely. I totally buy into that. But it's not okay to say one thing does one thing. I mean, even the guys who forecast the weather don't get it right, and they only have 20 parameters. We're dealing with millions. So it can't be like that. Any other questions? Okay, so what's your greatest learning from today?
We all need to
Yes.
Injections.
Sorry?
Graphene oxide in injections. I wasn't aware of that in anesthetic.
It's not. We test our batches and there's nothing in them. What it refers to, and I read that last week, is big injections that are given after surgery. We don't do that. So, but we still test all our batches.
Are you going to set up a school for dentists? No.
We're about to.
Oh, well done. That's why you're not practicing for dentists.
May I just ask, I gather that something called hydrogel has started to arrive quite recently in the normal dentist freezing mechanism. And certainly when you have that at a dentist now, it lasts for much longer and you can feel its effects much longer. So even that mechanism has changed for the worse.
Yeah. But again, we test.
Yes, you would, but as a normal dentist, you know, the process is getting worse.
Yes.
Yeah.
True. Other learnings? Okay, so what are your next steps? One after a time.
I just want to say I've learned that I don't have to be so frightened about facing my dental issues, and that was very important.
That's a big one. Fabulous, thank you. Any other next steps?
Yeah, your phone number.
With that, you know when you say that amalgam gets, breaks the teeth when they get older, and it must get worse. Do you is there a link between like elderly people and dementia? Do you think? Oh yeah. With this?
I don't think I know. And that research was also done 25 years ago with Alzheimer's, but they weren't allowed to publish.
Really? And can they detoxify it?
Yes.
They can detoxify it in elderly.
Yes.
So what's happened to the research then?
Well, what happens? Yes.
Have you found a manufacturer for those small brushes?
We're about to find him. Yes, I think we got one.
Okay.
We just now need to find that they use the right bristles.
What was that? What were you asking, sorry?
That's about blotting brushes. Blotting brushes are, from my account, the best brushes you can use. And there are a couple of reasons for that. A, you save on toothpaste. And B, the bristles are split. The blotting brushes were developed by a periodontist, which is a special dentist who cares for gum disease, Dr. Philip, in the 60s. And he, whether he went on a safari trip or he saw some Maasai with their miswak that they just pushed against their teeth. And he thought, that's interesting because those guys, they have perfectly fine teeth. So then he looked further into it and had a look how those miswak bristles actually look. And they had split bristles. And those split bristles are what's causing a kind of a vacuum to pull the plaque from your teeth. And then you do that on the location for a few moments. And then you either rinse it under the tap, under the filtered obviously, or you sip it out with your teeth and swallow it. That's how I do it.
So Western Price stopped producing them?
They never produced them. They bought them from the same people that we bought them.
But then they stopped either selling them or making them, because I can't get hold of them anymore.
No, you can't. No one is producing them at the moment. And Bryce Pottinger, they are selling now cold blotting brushes, but they aren't. And we know it because we ask them.
So there's no way you can get hold of a blotting brush?
Not at the moment. But that's the end from Dr. Phillips' story with the blotting brushes. None of his patients actually needed gum surgery when they used the blotting brushes. And as a periodontist, you always do surgery because that's where you make your money from. And that is what, I would say, for a few months helps your patients, and then they're back. Because again, it's just symptomatic treatment. You need to look at all the underlying things, whether it's emotion, nutrition, oral hygiene. With just one single shot, you might shoot a deer, but you don't shoot anything in terms of health. It's always multifaceted and multi-layered. So I think it's very important for you to make the next step, and you have, in a way, two options. You could say, okay, well, let's see what's happening, and you're not doing what is necessary to keep healthy or to become healthy or to get healthy teeth, and then you will suffer tooth decay, gum disease, and in the end, the worst of all, you will probably end up with chronic illnesses. And we know from statistics that 2 out of 3 people die from chronic illnesses. Now, this room would be pretty empty, so we need to make sure that we here are not one of those. And therefore, when you take action for that, you will keep or get healthy teeth and gums, and you will get a far better health. And it's very unlikely that you will suffer from any of those chronic diseases. And the choice is yours. Thank you.